I think we help answer complex decisions about the long term using all the data and evidence available, being complete geeks on a day-to-day basis. Sorry.
I think we'll move outside of the areas that we've traditionally worked in terms of superannuation, life insurance, general insurance. Actuaries are working into other areas that require a long-term focus, like healthcare, risk management and climate change, and I think that will continue. Actuaries don't have a predefined view of the world in terms of having a model and making things fit into it. When we do a job, we approach it as trying to understand how the world does work and making our work fit that. An example of the work that we've done that's benefited the New South Wales Government is following the introduction of health reforms a couple of years ago. We did a lot of policy, strategy and modelling work to help understand how money was going to be spent on healthcare in New South Wales, hospitals and other health services, not only now but for the next 10 years.
At the end of the day, there's been a lot of noise in the health system for a number of years, and no one's really using the evidence at hand to help make decisions about how budgets get allocated across the health system. What we did was work with the New South Wales Government to help use that evidence about the activity that's done in different hospitals, the complexity of that activity and the costs behind those to actually come up with an appropriate funding formula to help allocate the state's budget across those hospitals and local health areas. And I think that that's something that actuaries bring to the table, is using the evidence available to come up with a sensible model which helps people make decisions into the future. Did we sound passionate?
Really good.
My challenge is having to work with Kirsten.